documentation processes are also very, very careful.
They don't
if you
even
really look at them,
exactly.
because they don't really humanize the person involved. It's like, okay, you must bring a family member. What if I don't have any family?
So I feel like assessing public health care is difficult.
It's just how they made all manner of diseases queer. Hepatitis, HIV, tuberculosis, malaria, that monkeypox, everything is just queer people's disease. So there's so much homophobia around the healthcare system, and I don't know. It has to be somebody sponsoring this thing.
Hi everyone, and welcome back to another episode of Convos, a platform brought to you by Tears, where we bring online conversations that center queer identity and culture to you. I remain one of your hosts, Liber, and with me are
Vincent Desmond,
CJ Bamber,
Tammy,
Helena.
Period. And today we want to get into some things.
Yeah.
namely.
We're going to be discussing the exclusion of LGBTQIA+ in healthcare
Okay, yeah. So
in respect to the public health crisis in Nigeria. And what are your thoughts, guys?
okay, so I feel like a lot of queer people, you can't really like go to hospitals and tell them the full details of your life. And they're like, have you had sex? And they asked something. I turn my eyes. Because I don't know what you're asking. Are you asking penetrative sex? Are you asking like what kind of sex are you talking about? And then if they ask you what are your partners and is there someone you can call? You can't give them the full details of your life because you don't know what they will say. You don't know what will happen to you. So I feel like assessing public health care is difficult and challenging because of the things that could happen to you.
I think these people should be trained. There should be some sort of training.
Retrained.
That you don't
Need to focus on
exactly
LGBT
understand
people.
that this is your job. You are here to save life. You're here to save human life. Basically, this is supposed to be what. Despite your belief, whatever you want to believe in, just save my life, take care
your
of
job.
me. That's how it's supposed to be. So
Do your job.
there should be more affirming, clinics and healthcare providers. Really,
I think we're asking too much from people who are extremely religious, people who pray
And
first before they open a hospital.
I'm asking too much of asking the bare minimum.
bare minimum.
I think
Really.
we're asking the bare minimum. I think
Bare
I
minimum,
think-
yeah.
I-
Do your
I-
job. Do your
But
job.
it's too much for them because I have friends in medical, like they're studying to become doctors, medical school, and they say like they go to class and then the people teaching them just homophobia, straight up homophobia,
Yeah.
denying of like trans people, insulting trans people, and then these are people that teach the doctors
That's part of their
that
training,
attending to
basically.
you. So like from when they're trained, they're already trained to like disregard queer people and whatever they're going through.
So one now is a step forward. So should we actively look for queer-owned health
I feel
services? Is that really a thing?
like a lot of NGOs
Do have healthcare
and
available.
CBOs in Nigeria do provide certain health care for marginalized groups such as queer people, but I feel like there's always a
Stigma.
attached to visiting those places. There's an idea that if I'm seen in this place, people will probably
Implies
assume
something,
that like something is wrong with me
And here
or something like exactly.
cryotherapy.
Do you understand? Like exactly like
All
it's,
that.
and it's because of like certain narratives that have spun of like people's personal lives being used and commodified into stories like
Exactly.
within the community.
Yeah.
So I feel like we need to also like look around how we can demystify.
And that is first of all to understand that not everybody that visits these queer NGOs. Sorry, when I say queer NGO, I think it's just NGOs.
Yeah.
NGOs that are there to seek for health assistance.
Exactly.
Some people are just there to get information. Some people are just there for other reasons. Some people are just there for meetings, for trainings, for just visiting. It's a safe space, first of all. It's a community center.
And if you're there for those reasons that you're assuming, what's wrong with that?
Exactly, what's wrong with that?
What they're doing is what they should be doing.
Exactly. So like let's
They're
break the
being
shape from
safe,
the
they're being
health
healthy.
then.
Exactly.
Yeah, you're being healthy. So like I don't
So
think
I-
that should be a problem.
There's this thing about people. I've had cases like that on the app. People say, okay, we could do this, and you get talking because I'm very vocal about sex and how we should get down. Let's talk about it. Let's understand what we're doing. Then you get to ask, okay, are you on this? What are the measures? Should we do this? And you get questions like, are you clean? The first time I heard, are you clean? I felt, okay, well, I'm a very clean person. Please, have you seen me? Then, I'm clean. Then, are you clean? Then again, I'm like, but you, clean. I brush my teeth. Yeah.
Yes.
If it's down there, bro, I'm crystal.
Yes.
Then again, he said, no. Are you on PrEP or not?
Oh.
So, oh, you mean HIV? Oh, really? Is that what you
Terrible.
mean? So what's unclean about
That language is super.
Exactly.
Yeah.
That language is
The language
very
is
Education
stigmatized.
doesn't
Very
mean clean,
yes,
right?
very
It doesn't
violent.
mean clean. See, why would you say someone who has HIV is unclean? So these are some of the stigmas that causes people.
Yeah.
And when you talk about queer NGOs, where people get ARVs and
Yeah.
ARTs and PrEPs and all of that, people be like, oh, hit that HIV center. I don't want people to think I have HIV.
Yeah.
Yes,
There's
and-
a lot of,
Yes, and there's so many assumptions of like and
services
over
of the-
time,
yeah.
yes, like it's always occurred where like there's always a tendency for the general public to try to associate queerness with a certain ailment. Right? Where it's like we know what happened with HIV
Yes, but they're
and
not,
queer people, and we saw what they tried to do last year with monkeypox, where
Yes.
they were trying to push the agenda that like
Gay men
oh,
having sex.
there's
Gay
gay
men,
men,
yeah.
that, exactly like, and all of that also does affect queer people themselves, where they start to now feel like oh, because their queerness automatically
internalizing it, yeah.
puts them in like
This situation.
yes,
most
when it's
likely
like
to catch
you can be
the
very
virus.
easy, you can be very easily exposed. You're as susceptible as an heterosexual person, right? It's not.
It's
There's
just
no higher tendency.
It's just how they made all manner of diseases queer. Hepatitis, HIV, tuberculosis, malaria, that monkeypox, everything is just queer people's disease. So there's so much homophobia around the
Yeah.
healthcare system, and I don't know. It has to be somebody sponsoring these things.
Okay.
Yeah,
Of course,
it's
now,
far
it's
right,
propaganda
right,
now.
And the narrative that they use, it just sometimes I sit down and imagine the mental state of, let's say, someone who is suffering from hepatitis or tuberculosis and all of these things, sitting down and watching these news or
Yeah.
reading these articles
Reading these things being said.
imagine, like, oh,
Even therapy, right?
Yeah.
I think it was 2020. I signed up for therapy, and I met this therapist on Facebook, and everybody that he came highly recommended by some of my friends and networks. So I went to visit. I paid for a session. I paid for 3 sessions actually at the beginning because I was really, really down. And when I got there, we first prayed.
Oh,
Red flag number
red
one.
flag.
It's
Red
a
flag,
wrap.
red flag.
Once you start
It's a no
red
prayers, I already know that
Yeah.
this is not going to end
It's
It's
well.
about to be a church service.
But I really needed help. I really needed someone to talk
Yeah,
to, and
yeah.
there was literally nobody to talk to. So after the prayers, he was like, "Oh, okay." So like he would ask me some personal questions before we would start, and then, "Oh, so what's your name? What's your age? What's your sexuality?" So I'm like, "I'm queer. I'm bisexual." My dear, I did not do therapy.
That's Sunday school.
This dude legit left the depression, anxiety, PTSD that was worrying me,
I went straight to the cure
Sexual
and
sexuality.
he was telling me how sinful homosexuality is, and how the reason I'm being depressed is because I'm queer, and and that anytime I stop being queer, depression will
real.
flee from
I did have
me.
the very similar experience.
You did?
Continue. I'll say back.
That anytime I stop being queer, that depression will run away from me. That in fact,
Like a bed.
the reason I'm
Evaporates.
even having financial problems is because I'm queer. That is a spiritual problem.
Okay.
It's a mental illness.
Isn't that supposed to
So
be like a regulatory
I
way to
should,
report this?
and this person is not to be. So I feel like this person should not even be called a therapist.
They're regulatory bodies too. They will pray for you.
Yeah.
So I'm sorry. So
for you.
I have a very similar experience to yours. My very first time in therapy. This was years back. So I went to therapy with the hope of talking about my relationship with my parents. But then in the conversation, I kind of just brought up my sexuality as a passerby remark. And this woman left the whole bit about like my mom's, and she kind of just said that, oh, but you know what's causing all of this, right? It's because you're gay, and like God's kind of using this to like try to draw you closer to him. And I'm like, I don't think God needs to be giving me like a moral lesson like when I'm this young. I use my parents' marriage to be teaching me this, but sure, good math. I get therapy math, wherever that is.
So if something happened within this year, and I needed some counseling over a particular issue, and of course I always resort to queer spaces, thankfully. That's because I have access to it. That's because I have knowledge.
Yeah.
So a friend of mine also referred me to a very nearby one that I never knew existed. So we should also pay attention to publicizing some of these places within the
Yeah.
community.
Yeah.
Because
Yeah.
I've lived in this place before. I never knew there's a place I could just take one drop. And so I got to this organization while I was waiting for the therapist to get done with the other person that came before me. Then a staff, okay, there was this altercation when I was coming, trying to get the address because I never imagined it was that close. So I got a number of a staff, and before I got there, we were talking. It got to some point, I felt he felt frustrated by the too many questions I was asking, and he yelled at me. And of course, I banged the call on him. Then when I got there, apparently my friend must have called him that, oh, he's there, he's in your facility, that I was in the facility. Then you're like, are you CJ? I said, oh yes, I'm CJ. And he called his name. I'm like, oh, sorry, I'm finally here. And I said, wait though. You were the one that bank call on me. Why? And within the state I was at that moment, I didn't expect that. I was like, yeah, I banged the call because you were shouting. I didn't want to. He started yelling at me. And of course, I fought back. You know, it was a huge back and forth. They tried to separate us. Then he called me names. Of course, I called him names. But then, that was me. I refused treatment and I went home. Then again, that night, I tried to get informations on their organograms, who their ED is, the board members and stuff, and I was able to land on it. And I called one of the superiors, and just within 24 hours, they copied me in a suspension letter. Right? And I was really excited. I was like, okay.
Exactly.
Thank you. Thank you, Jesus. Then again, the friend that referred me there started begging. Oh, CJ, you know, it was through me that you got there. You know, trying to mentally blackmail me, emotionally blackmail me. I fell for it, I must agree. But what I did, because I had to go back to make them understand that I didn't want anything happening to his source of livelihood. That was what I did. But then I was happy, really, that something could be done within that very short period.
Exactly.
And that was because it was me. I could speak up.
Yeah.
Some of the very young queer persons could get there. Imagine just getting there within your state, trying to get her. Somebody is coming to yell at you in that place that's supposed to be your safe space.
Exactly.
Imagine it. Imagine the notion you will have while leaving. But then I fought back. Thankfully, we're cool now. We're friends now. I still get my, therapies every now and then. But then there should be some comfort. A safe space should be a safe space.
Yeah.
A community center should be a
Absolutely.
community center.
When you were saying something about the staff, so it's something I've heard a lot about, like, people in the community, about like why they don't usually go to like spaces where they can be tested and everything, is that they don't want to be used as just in the community, because like what they say is that like if you go and you get tested and maybe you're tested like positive, like HIV positive or something, and then people that were not there when you were tested would know, because they would spread the news around.
Right.
So people are like, I would just rather not.
Yes, there have to be
go to
consequences. And that's why I really
Yes.
like the story shared.
Me see, if I ever get outed in any circumstance, let's say I go for, like you said, HIV testing, and I was tested reactive, and somehow I heard the news out there, and I know say me third person, I will return to that place, and I will let you know what happened, and why it shouldn't happen, and why you must face the consequences.
Exactly.
And I think people should be empowered.
Yes.
I don't care how I do it, but it must happen. In my watch, and it won't take long. Go. Like, I'll give you time where it will happen. If you shout that person, and I must get a redress.
Aside from retraining healthcare people, I also feel like people who give services like massage services, spa services. So, story time. I linked up my queer friend, with a masseuse, right? This guy is very good at his work, and I have recommended him to some other people, although most of them were straight. So I also like booked for this massage for myself, right?
Don't know who you're talking about?
No.
Accra Beach?
No.
Okay.
No, not.
Okay.
Not. So, this person, the masseuse is straight.
Oh,
Is not
all right.
queer.
Okay.
It's straight, yeah. So, the massage was supposed to happen at my friend's place. He massaged me first, and then after that, he now went to massage my friend. Right?
Friend is queer.
My friend is queer.
Right.
I'm queer. This masseuse know I am queer,
You're queer,
right?
okay.
But he didn't know that my friend is queer. Yeah. So whilst he was giving my friend a massage and everything, they were talking, because usually he would talk. He tell you, is it okay for him to press you here, touch you, blah blah blah. and everything. And he now asked about her sexuality, knowing obviously that I was queer, right? So she thinking that he's like a safe space, or she's like, that she's queer. And this dude left the massage that he was supposed to be massaging. I was telling her that, man, it's because she has not had good penis.
Oh, she hasn't
before.
paid. Oh, she hasn't paid.
That I was the one that was supposed to pay. Yeah.
Right.
It was because she hasn't had good penis before, that once he handles her, that after this massage, if he understands, that can't she be a virgin at so age, impossible, blah, blah, blah. She had to stop the massage halfway because, like, obviously she was becoming uncomfortable.
Yeah.
And so I was in the other room, and then he came to meet me in the other room. I was like, oh, he's done, that he wants to leave now. So I was like, okay, no problem, I'll transfer your money to you.
Right.
So he sent me his details and he left. No, before he even left, I was doing a video and he was trying to jump into my video and everything. So later, my friend, I didn't even know what happened because my friend waited for him to leave.
Yeah.
So she told me that, oh, say what happened, blah, blah, blah. She was even like in tears, that he's now started touching her inappropriately just because she had said she was queer. He was very professional prior to knowing that she was queer. Until he knew, and then he started being inappropriate.
Sexualizing her.
Yes, that's touching her in key areas. So she was traumatized. And when he got home, he texted me, was like, "Now what's up? He has not seen the money." I said, "You're not going to see any money."
Yes, girl.
Exactly.
What money? I said, "You're supposed to pay my friend for traumatizing her."
You mess with my
Yeah,
friend, you mess
exactly.
with me.
I don't understand. It's like, "Oh, Elena, but you know me, I don't have a problem with you being queer." I said, "But you touched my friend inappropriately, and you
make her
tried
uncomfortable.
to convert my friend by saying, oh, it's because she's not
using those type
even
of
if she
phrases.
wants to get laid by a guy, is it going to be you?"
Again, at one point, do we get to involve family members in a case whereby, let's say, somebody brings a sick person to a healthcare center? It could be emergency, and at that point, the sick person cannot talk, cannot respond effectively. Then, however, there are informations you as a sick person, ordinarily you wouldn't want the people that brought, let's say, family members out there to know. And there, the healthcare provider begins to divulge, telling these things that ordinarily, and
that's still improper.
that's still very improper. That's
but
but these are the
it
things they do a lot. These are the
It
things they
happens.
do
Yeah.
a lot. Your test will be out. They would even give it to that family member.
I
Yes.
personally, I have a lot of issues with like how a lot of healthcare is documented. Personally,
Yeah.
I do not like the fact that, for example, like a pregnant woman, if she has needs, it has to be a husband. Like, the documentation processes are also very, very careful.
They don't
If you
even
really look
Yeah.
at them,
Exactly.
because they don't really humanize the person involved. It's like, okay, you must bring a family member. What if I don't have any family?
Yeah.
Exactly.
Right.
What if I don't have a
What if
family?
I don't have any family?
Right.
I cannot get healthcare because I don't have a
And they
family.
go by, who give you belly?
And then something that is like tangentially connected. So when like you start a new job, let's say like your career, you start a new job. Some jobs require you to get medical reports from the hospital.
Yeah.
So normally, legally, they are not supposed to include like HIV testing.
Right.
Listen,
Yes.
but some jobs
They
will not tell you.
insist.
You go because they will say in this hospital. Sometimes they have a designated
They have a
hospital.
designated
You go there, you wouldn't know that you're
You
testing
drop
for
a blood
HIV.
sample, yeah.
You drop a blood sample and then they can just fire you.
Right.
It's illegal, but like they do it,
Oh my god.
Yeah.
and without telling
Actually,
you.
for food handlers and those within the
Yeah, just
food
like
and beverage
a lot of-
restaurants.
Even like
hospitality or-
exactly.
corporate jobs, they just require you to get a medical report, and if they don't tell you the test because it's illegal for them to actually take
Still.
an HIV test,
Yeah.
and then they don't tell you, they just do it, and then you are fired the next day, and then you don't know why. They
That's a
won't.
lot.
They just won't tell you.
And there's so much stigmatization because I remember like last year when I was really sick and I almost had to get surgery, like it was the ending of me. Because like at first I had gone to like the NGO clinics and I wasn't getting any answers. Because like they kept saying do this, like this, that, and I was like, okay, it's not working, like this is the problem. Like even that there was a bit of a struggle because I kept communicating something to the doctor and he kept ignoring my needs because I'm like, he's saying this, I'm like, no, it's not that. Like, I'm the one going to do it. I'm telling you that, yeah,
It's
you're
something different.
misinforming, like, it's not the same thing. And like, there was so much like back and forth and like, eventually I went to another clinic and that was when like, they put me on the right track somehow. But then eventually, like, there are limitations to what the NGOs can do.
Yeah.
Because when I got to find out that I would need surgery, I had to meet with like a general surgeon, which means I have to go to
fall back to the public.
I have to go to a public
system.
healthcare system. I had to degender myself, and I mean, at that time I already started medically transitioning.
Right.
So it was a very great area because like, okay, now they're going to do tests and like you have to start explaining certain things because it's like, okay,
you have to
how do I
retain
say,
information.
how do I give out this information? Like, and it was so, I don't know how I managed to get it done because it was very traumatizing. But like eventually I found out I would need surgery, and even then that was now traumatizing again. It was like, okay, now you have to go through surgery because surgery means more tests,
More tests.
more everything.
Exposure to harm.
Yeah.
And it's also expensive.
So accessibility to PrEP. So funny enough, we all know about PrEP. We all know PrEP
Yeah.
is, you know how to get it and stuff.
Yeah.
But there are people within the community.
Like preposition. I'm just kidding, guys.
There are people within the community who do not even know that this exists, let alone where to get it. And again, do we have enough? Do we have enough centers that give this? Is it always available? I'm asking because I am not sure.
I know there are certain organizations that allow for like pickups and like dispatching
Oh, they could dispatch.
of medication.
Yeah.
Beautiful.
I know there's that. I feel like there is a lot. I don't know about how far it gets, but I know there's a lot of efforts towards making sure it goes
It
far
goes
and wide. Because I know like I am aware of a lot of outreaches to where they do
Yeah.
tests for
Yeah, they
people.
test
They give them medication. They
Yeah.
give them like they help them create their records. And they keep track of them. They have their information. They're calling them constantly. Are you on your meds? I know like that exists.
Well, you know, it's one thing to just get PrEP and I'm on PrEP, and you keep taking PrEP. And there are follow-ups to ensure
Yes,
that
there are.
Yeah,
these
yeah.
individuals.
But I
Yes.
think it depends on where you are, because I think someone DM'd me. I forgotten what state they were in, but someone DM'd me from a completely different state, like asking, "Oh, where can I get this?"
Okay.
And
I'm
the,
talking for Lagos.
yeah,
Yeah.
they didn't really
Just
have that
Lagos. I mean,
in
Yeah,
that
Lagos, I
state.
know.
Yeah, they didn't really have that in that state, so I had to go and find the nearest like states
States.
that
Oh,
had
wow.
that.
Imagine
Then you have to
traveling.
like be like sending it across, because not every state has this. Like
Yeah.
we have quite a number of states that
I have covered.
I feel
have
like
these services,
So the
but not
accessibility
all
is
of them.
not easy.
Yeah.
Yeah.
Outside of Lagos.
And in huge states, because Lagos is quite
They
small.
are quite small.
In each state, they only have one clinic. Like if it gets exhausted, not everyone
Yeah,
has the
exactly.
same fund. Not everyone has the
Like
same
even then,
resources.
it's hard to reach. Because if
Yeah.
it's one in your state, like imagine like living in Lagos and like there's only one and it's like in Ikeja.
And then
like,
you have to take. And
It's
especially if you're,
accessibility.
especially if you're poor and queer, and
Exactly.
somewhere like really far, and you have to spend money.
You have to spend money
to
transportation
get
to get
there.
there. It's like
I feel
It's a
like
lot.
we just need more LGBTQI plus focused healthcare.
Yes.
Affirmative
And then like
services.
with
Yeah.
Do
the
need them.
homophobication, because they need to go, like the
If-
queerphobia
if-
needs to go in the major ones, because why can't we be free to access the ones already?
I'll be very honest. I know that everybody like knows this bodies or these services exist in Lagos, but I didn't really know about it till like last year. To be very honest, I'll be very honest. I mean, I know that it technically exists. I didn't need it, but I didn't know how to access it till like maybe last year.
Okay.
So I think everyone is assuming that. Even in Lagos here, that there's access to it. There's access to it. They exist, but does everybody actually know? Because most of these things are very hush hush.
Yeah.
People for safety or
It's
whatever.
exclusive
Yeah.
We
information.
within the
It's
movement
just
and
within the
those things.
community.
Exactly. It might be
Yeah.
loud to us.
Exactly,
You might
within
think
the
everyone knows
movement.
it. You meet somebody and they're like, what's
Well,
PrEP?
exactly.
yeah.
It's not HIV drug.
And then
And
it's
you're
for you
trying to
to
educate these
tell
people. They don't
them.
even have
Exactly.
knowledge
Yeah.
that this
Yeah, we can,
exists.
like, point
So
to
can we talk about how these drugs, or rather
Just in general,
The healthcare services.
healthcare services that are supposed to be meant for community centers
Okay,
fall in the hands of the
so-
streets? Like PrEP, I had a case of a man who told me that his gay friend gets him PrEP. And
give him.
exactly. So this guy probably collects and sells to these people.
Oh my God.
I don't know how true that is, but I believe him because I saw the PrEP. So how it got to him, I believed what he told me, or rather, I heard what he told me, and it wasn't pleasant.
Oh, wow.
So for
just
like
sad.
healthcare,
That's
niggas,
just
like if
sad.
you want to get tested, I know that like there are a number of places. I know like TRS, I know like CPHI.
Yes,
because
CHI,
I get tested at CPHI, but then
Shrine, so
see,
many.
like I feel like maybe we can do like a little master doc thing, because I see them all on Twitter. Like,
Yeah.
So where to get tested, where to get PrEP, or like special days for PrEP, notification, what are ARVs? Because I know that TRS has like all these social media posts. What
They
is
even
PrEP?
have, like,
What is
postcards.
ARV? Then for queer women, like cervical cancer screenings, like they do all of that, and sometimes they do activations or like testing somewhere else. And I see tears at events giving out like protection,
Contraceptives
yeah,
and stuff.
yeah. So like I feel the information is there. Maybe not everyone knows it. So
Yeah.
the only thing we can do is to
Push it
make
forward.
it
Make it
push
more
it more.
accessible.
Right.
Push
Yeah,
it
just
more.
push it.
and
push for it to be
like
more
get
accessible.
queer people to be more open to receiving these services.
Yeah. So PrEP, PEP, vaccine, and that's it.
Testing,
Yeah, testing,
Testing.
regular testing.
protection.
Very
Protection,
importantly, protection.
They
Just
give
in all,
free- they
in
give
all,
free
in all that you
protection.
do, just get a
Stay
condom.
protected.
Engage
Please, wear
I feel like the
condom.
condom is very specific to like
To
queer men.
male,
Because queer women.
Tears
like-
give. I've collected.
Did you
I've
use
collected
it?
female condoms from Tears.
I, did you use
Yes,
it?
yes, give female
And
condoms.
the last time I asked, but then I feel like queer women specifically do not use protection.
yes.
Like, I feel
Like there needs
comfortable
to be
giving
more.
a
There needs to be
statistic
more
like
awareness
majority
around that.
they use protection.
Yes.
They just
Yeah, and I feel like there are even a lot of things that are not even said. Because like I know like even like when you participate in oral sex, there's supposed to be a condom involved.
yeah, a
But, like,
dental dam, but
Yeah,
like,
or a dental dam.
yeah,
But like a lot of
but
people don't know that.
and then I don't know that it's like they feel like women not
Yeah,
really,
exactly.
not really.
Yeah,
It's like you
penetration.
can't get like.
Oh, me, I always ask my partners to test though before we
Yeah,
get
Like the
absolutely.
majority of
But then,
patients-
that's dicey. Asking someone that you want to get down with to go get tested. Is it
I
that you go and
feel
get
like it's
tested before you
casual.
come back,
for
or
my
how?
health, it's for your health. We will both
Yeah,
go
you're
and do
supposed
it
to-
and
Let
come
me
back.
understand. Let me understand. Let's be clear with this. Is it like, okay, you scheduled to meet with this person, and when you now meet, okay, we should get tested. Let's go.
No,
No,
do you have
before
a
you
recent
schedule
test?
the
Before you
testing.
Yeah.
Yes.
Do that with,
But also,
You will ask.
you're polyamorous. You do that with each partner.
No,
My bro, I do it with each and every
so no,
female.
that-
I
that's-
have, yes, because with men I use
let me say how
condoms.
the thing is
With men, I
best
don't have
used.
sex.
So if you're regularly testing, maybe like every 3 months or so. So if you want to have like a product, you bring your most recent test result. So that's if you go that day. Or if you want to test and you go the next
Do we
day.
consider window
There's some
periods
people who don't
for
even
HIV?
do tests.
Yeah, but they're like, if you want to be
Yeah,
sure,
so that-
bring a most recent.
But this is about like people that you want to be committed to or
True.
wait for like a good amount of time. But like we have gay men walk. It's very much quick, very much casual,
So we random book up.
today
You involve
exactly.
protection.
Yeah, that's why you
We
do
random book up.
protection.
You involve protection.
Okay,
Yeah.
fair enough. Fair.
Right,
Yeah.
fair
Okay,
enough.
no, but like what you said now about like oral sex. Now let's say random example. Let's say let's use
Let's have a story.
I'll say random example. But you know, let's say you go to a rave and then somebody somehow you end up giving head to somebody. Somebody somehow in the bathroom.
At a rave.
Yeah, it can happen.
What?
Tell us a story.
I have friends.
You
I
have
have
to-
I'm sure it's
you
friends.
know
You
somebody.
friends, so
You can fall down and something will enter your mouth.
Exactly.
You can just like, oops.
Like play, like someone somebody somehow.
fall down.
Yeah.
this person will just disappear in the middle of the rave and come back after. I'm like, okay.
Oh my god.
Later I'll not be hearing stories.
I need to leave the group chat. I'm leaving now.
Okay.
Oh
You're part of that.
God.
I've never
I love
done that.
I love to take
I cannot
adventure
confirm or
breaks.
deny.
I love a good adventure break.
Exactly.
Where did you people find this? It never comes to me.
It's all
I
around
have a
you.
lot of things, but I'm not these.
What do you mean?
I'm a lot of things.
Not slut
Not slut shaming.
I'm
We
not
need
slut
to
shaming.
discuss
No.
the shaming
You-
actually.
No, I'm not slut shaming. You said you cannot confirm nor deny, and you're trying to accept. But I'm saying
Accept.
I am not these.
What's wrong with a rave night stand?
It's not that's a continent. Yeah.
This is my reality. This is
Yeah.
my reality. So I'm just
Break
saying
night
I am
stand
not.
today.
Okay,
Yeah.
so now you're engaging in a rave night stand, and it's a quick thing. Nobody has time to go and check test results. Nobody has time to bring out. And nobody, let's be honest, nobody's really bringing out a condom to give a blowjob. What's the way forward? Do you risk it?
Okay.
So what about checking? I know that's very minimal. You cannot really
You
know
put on
things and
flashlights
things.
and look at
No, I could do that. I could do that, but I'm not saying.
No,
but I
I
could
feel
do
like
that.
us
It's
saying
just
that
embarrassing
if you get
and
tested
do.
regularly, if put like if
Yeah, I
it's
feel like
more
if
prominent,
everybody is getting
everybody's
tested
tested
regularly,
regularly.
everybody's
Yeah,
aware of the
everybody
risk they
would
carry.
say,
So we should
like,
push. We
okay,
should push.
by my
yes.
last, by my
Exactly, we
last
should push
year.
for regular testing.
Ever
Because if
since-
everybody's getting regularly tested,
People
everybody
need
is
to-
more aware of their most
Everybody-
recent health,
They will
like
know exactly how to
status.
carry out.
Exactly.
And also, I guess
So and then it just
this is where
creates
PEP
safer.
comes
It
in
creates a
too.
safer
This is where
environment.
PEP comes in
This is
too.
where PrEP comes
Yeah.
in. Yes.
Yeah, it can't be
Yeah.
PrEP is
an
free.
entire
No,
100%
no,
risk.
like let's say after.
But you
Oh,
try
after
your
you
best.
Yeah,
test
after
it,
like
Yeah,
Sure.
it can't be 100% risk free, but like
Yes.
Do your
you
best.
try your
Just
best.
do
Yes, just as
Do your
safe
best.
as
Kissing comes
possible.
with risk.
Yes, as safe as possible.
Rush, hips, and stuff.
Yeah, and I was going to also discuss something as a doll.
Okay.
For dolls, like healthcare is very complicated, right? For trans people generally, because there comes the part of like HRT and like several other gender affirming health processes that you consider and want to take, and they are not readily available in the country. They are not accessible. They are not prescribed anywhere. So a lot of trans people resort to self-medicating, right? And self-medicating is a very complex thing because it's like whatever works for one person may not entirely work for you. And so you have to constantly move around with the risk of, you know, like it's a trial and error situation where you might be put at certain health risks just because of you're trying to affirm yourself. And medication is not readily available. Like it is very inaccessible, it's very expensive. And it's just like, it's...
So are there like any safe way to like engage with it? Like right now, like during Nigeria, are there like safe ways to engage with like HRT and stuff like that?
You buy it and you try it.
Are you go for the best, I guess?
Like, even going to the pharmacy, I feel like
even going to the pharmacy, right? I think what has made it much more convenient is the concept of like dispatching. Yes, like I
could not call it pharmacy.
Dispatch. It's more recently that I started to go to pharmacies to get my meds myself because it's like, who's gonna check me, bro?
Right.
Like, who gonna check me, bro?
Right.
Right? And it's like, but like for other people, I know like it's not like that's a privilege in
for
itself,
people that don't have that, like.
So like most people, like I know that they order online. Most people they go to the market. Like I know, yes, I used to. Someone used to help me to get to the market at the time. That's why I should be good allies, right?
Yeah,
exactly.
Like,
These are the
looks
things
like.
that allies should do. Because I had a cishet friend who was helping me go to the market to get my medication because like there it's cheaper and like all of those things.
So like what like solutions would you like to see like in your dream world? Like you are designing this yourself. What is that?
First of all, my dream world, they're not STD, so everyone can be free and be smart in peace. Like, I'm sorry,
In
get
your
that
dream
from
world
there.
with STDs, in your dream world with queer people, what are the hospitals like? What is the healthcare system like?
The healthcare caters to the complexities of queerness.
That's
Like more
They do.
information,
Give me your
more
journey.
training.
Because I feel like even
for medical
generally,
personnel.
even the way healthcare system works, generally, it's very queerphobic naturally. Because like if they give birth to a child today, there's no proper testing done. There's a lot of assumptions made.
yeah.
Exactly.
Because I know
Intersex.
I know someone
Yeah,
that found out
intersex genital mutilation.
that I know someone that found out that they were intersex much later in their life,
Exactly.
right? And like it's like those are type of information that you should be equipped with. Like those are things that should not be assumed, right? That should be immediately like, okay, we need to have like information. Like they'll say full health check, they're not full checking anything.
I really wish that we can get past it. It doesn't matter if you don't want to be out or not. There are ways as a queer person in healthcare that you can implement some of these things. You can probably even say, oh, if I'm the owner of a hospital, I'm going to retrain my staff so that they have more information about queer people, LGBTQI plus people. And this just makes it even more inclusive. Because if a lot of queer people, especially in Lagos State, know that, oh, there's a hospital that is inclusive, that is owned by a queer person, that they can go to get tested without having any form of fear, of shame, or of, what is going to happen if they discover anything. It's just going to make the community a lot more safer.
So I think they cannot practice what they were not taught.
Yeah.
This thing should be narrowed down to the grassroots, to the curriculum, to the medical school.
Yeah.
Do you understand?
No,
we have to change a lot of things.
From basic science.
Because basic sciences, it will shock you that a lot of doctors who do not understand the concept of intersex.
Yes.
Do you understand? To show there are a lot of medical students who cannot tell you anything about these things. So you should be taken to the classrooms. Then from there, take it from there. Because telling someone who barely know these things to start practicing them after 5 years of already practicing.
5 years after
it's 20 years of practice. And you want them to start imbibing and embracing new teaching. So it's a whole lot. So it's only what they know that they are given.
And then medical students are like stone in the sea.
Right.
Like when they are in these classrooms, like queer medical students, like their student when they're in these classrooms, the homophobia that's perpetuated, the whole classroom is laughing with the
makes
lecturer.
them uncomfortable.
They suffer these
They
things.
suffer these things.
The only difference is that they're going to be doctors. But like this, how many doctors out of like an entire class of 500 or how many? Yeah, I feel like they do give to the community. Like the queer psychologists we have, the psychologists that work with people, the doctors you see in the health centers that cater to queer people, they are doing the work. I just feel like we can't totally rely on them.
One maybe small way I think queer people in just healthcare could do a little bit better is maybe if you see a queer person in a population center or getting help, getting like medical help, go for a checkup. Maybe don't tell other queer people that this person.
Yeah.
Guess what I saw?
Guess
this
what I
people,
saw?
come together,
And there's
HIV
always-
tested.
and there's always
then
assumptions.
Exactly.
Yeah,
Just
it's never
because you
facts.
saw me here, it doesn't mean anything. And even if it means something, maybe don't start
where's
spreading
the
my.
doctor?
I mean,
Confidentiality,
I feel like we
like,
even
what's
need
your
to, we need
confidentiality?
health education, right? Remember, I was at a clinic one time. I wanted to take out a skin tag, right? And then I was like, oh, I saw someone that knew me. Then he was like, oh, why are you here? I'm like, oh, I'm here. I just said cryotherapy. I just said cryotherapy, and he was like, oh, you have another.
And I what?
I was like,
Yeah.
cryotherapy is just like using like a very cool.
Release,
Do that,
laser
take
to
off
like
stuff
take
from
off
your
tag.
skin.
Oh, so you
Also,
thought you wanted to cut off your...
No, he thought I had what?
That's a lot of
It's that
assumption.
process
But
you
I
use
just had
removing
I had a skin tag on my thigh.
It's the process they also use in removing skin tags
Yeah.
and all of that. So the moment she said cryotherapy,
Yes.
your
Made it
So
jump.
I did not even think
and I
that
was.
I not think they'll think. I was just like, oh, cryotherapy, like, yeah, something.
Of course,
So I'm
cryotherapy.
like, I was like, oh.
That's a lot.
Like, why do you
That's
react-
crazy.
So
Why are you baffled? I
Yeah.
can see your expression.
yeah,
So like,
we used to
From
deal
where
with a
to
lot
where?
of like stigmatization around like just like there needs to be more health education. Like people need to relearn and learn a lot of things about their health. Like I feel like I was more privileged because I grew up in a family where there were like medical doctors and students. So I used to hear a lot of things. Like that gave me more information. So
the healthcare system.
about the healthcare system. So like I was exposed to more information around health generally, and I don't think a lot of people are exposed
In that
to
way,
a lot
yeah.
of
Yeah.
And for
information
queer
about their health.
Exactly. And for queer people who can demand certain things.
Oh, demand.
Yes.
Oh.
Yeah.
Demand certain things. Stand your ground, hit that table, raise that voice, tell them I deserve medical care. I am human, and you are here to save human lives. I am one. Treat me like one, first of all. So I think sometimes these people do this thing because the whistle blowing is not loud enough.
Yeah.
So sometimes you just have
Yeah.
to leave the shame.
Yeah.
Shame is terrible.
Because
Fear
see,
is
see,
terrible.
see the person who you know called and they got almost suspended.
Yes.
That person will be even better with the next
another
person.
person.
He calls me Mr. CJ
Exactly.
now.
That person
He calls me
will be
Mr.
with
CJ.
everyone else.
So he calls till date. He calls me Mr. CJ. He checks up on me every now and then. Do you understand?
Exactly.
Exactly. So learn to if you can demand.
Demand more.
Demand this. Remove the
Demand
shame
better.
and demand. And if you can, raise that camera up.
Oh, absolutely.
Oh, yo,
Yes.
as you're demanding, put the camera there. Go live.
You need to deal with a lot of the negligence.
Yes.
I feel we had a good conversation.
No,
Yeah, I feel like
Everybody
we-
agrees.
Yes, are
Really
fantastic.
good.
Oh my
God.
that's so good.
Oh, like CJ would say, we need training. Every episode this season, training.
Training.
We love a
People
training.
cannot
queen.
give what they don't know.
Exactly.
Exactly. So you need to train them.
Exactly.
With them.
Thank you.
Yay.
Oh,
You guys are fantastic.